Hello, everyone. I'm pleased to join you today as we discuss matters that are important in our society and in our personal life. Today, we are going to speak matters health, and I know that whatever we are going to discuss will be of great importance to every one of us. And therefore, I encourage you, wherever you are, to be a follower of our channel because we're going to discuss matters health, which are so vital to our daily life in every area, in every society, in every village, in every hospital, in every country, and globally. We talk about health. Why do we do so? It's because matters health are vital to each and every life that we live in a daily basis. That's why we need water that is safe. We need a shelter which has a safe environment free of infections and diseases. We need a society that is caring, maintaining its environment to serve the people and to realize the importance of maintaining health around the communities. We also do not leave behind the nations. Each and every one of us needs his or her nation, his or her country to observe, to put policies in place that are better, that are leading to the enhancement of better health in our society. And that's why today I am pleased to discuss matters health with you because I know this is a topic that has great impact both positively and negatively in our societies and even in our own individual lives. Now, allow me to introduce a topic today that we're going to discuss. And this topic has been discussed in various forums. Even some of us have been engaged directly with some of our medical providers about these topics. And these are infections that we come across as individuals in our daily lives. Some of these infections we know or we realize how important or grave they are. And some of them we assume that they are nothing. And then even if we experience symptoms and signs, we say, are they going to go away? Which is wrong, as we are going to see. So as we continue, I'd like you to subscribe to this channel because we shall be discussing topics that are important to our lives on a daily basis. We shall be discussing on topics that touch on our health issues on daily basis and personal, very, very personal. And that's why I'd like you never to miss any of our discussions in this forum. So today, without wasting time, let's talk about UTI. UTIs or urinary tract infections are infections that actually are here with us, and most of us have had them, have come across them. We have been infected with them, or our loved ones, or even the people we know, or some of us have had medical personnel talk about them, or even teach or educate the society about them. Now, what is UTI? UTI, these are infections that mostly come through contaminations, and especially contaminations that are associated with sharing of certain things and certain washrooms. By me saying that, I mention and categorically say that sharing of toilets, sharing of some of our personal clothing or some of our personal essentials like towels and even basins that we use to bathe ourselves are a remedy to these infections. Now, what are some of the symptoms of this infection? The infection, when you are infected with it, generally uh, across board, that is talking about females and males at the same time. In most cases, in females, they will experience itching of their private parts, an abnormal discharge, that is vaginal discharge, that is not normal. Some of it is smelly, some of it is not even bearable, and some of it will require a medical attention. Some of the infections also will include lower abdominal pains and associated with the low back pains that are always on and off. And some of these symptoms or signs come and go, of which can confuse someone that it is just something that was normal, or maybe I didn't feel it well. Let me wait again for some time so that I can feel it. And in male, in most cases, sometimes these symptoms do not appear. That having said, I mean that for most of the male counterparts, you will realize that they do not feel any type of symptom or any type of sign. And therefore, most of the male partners, they will stay for long without realizing that they are suffering from this ailment. Now, what are some of the diagnostic processes that we have to put in mind? One, if you experience some of these symptoms that I've mentioned, that is a remedy for you to run very fast and seek medical advice. And when you go with these symptoms, most likely your medical personnel will prescribe a diagnostic measure whereby your urine sample will be taken and taken to the lab so that it can identify which type of bacteria is causing this so that appropriate treatment or medication can be given. Now, some of the diagnostic measures also, apart from the urine, it will be a blood sample which can be taken so that it can identify any type of infection that is involved. And if more type of investigations will be required going forward. And some of these are also associated with a scan, or let's say even as an abdominal scan that is gynecological or obstetric. And that one will actually depend on how your medical personnel has assessed you according to the history you've given to him or to her. Now, some of the adverse effects of this type of infection are there are chances that they will affect your fertility status. That means you might, if you are maybe looking for a child to conceive, your conception process can be hindered by this type of infection because this type of infections actually come in force. And one of it is the vaginalis, urethritis, candidiasis, and PID, that is pelvic inflammatory disease. These categories have their own diverse effects, and some of these effects will lead to infertility or delayed conception, of which means it will require more medical attention for you to be relieved from it. And what about prevention? Prevention, as we studied earlier, will look at the causes. So the causative measures or the contributing factors actually will help us in the prevention measures. So with these prevention measures, one, first of all, you have to understand the importance of your personal hygiene, whereby you have to know that things like towels and basins must become personal. By becoming personal, it means you have to ensure that every time you reuse them, they are cleaned before. In terms of toilets, ensure that wherever you go to any toilet, especially even a public toilet, go to a toilet that you trust, a trusted toilet, whereby you will be sure that this toilet is safe for my hygienical purposes in order to avoid such infections. These infections sometimes they are identical with STDs. An STD, which is a sexually transmitted disease, it is a disease that if you hear of the name, that's when you know how diverse or effective it is. But when you hear of UTI, some of us assume, not knowing that some of these adverse effects are as harsh or chronic or can lead to danger just as an STD effect. So that one means we have to take the UTI type of infections as serious as we will take an STD. Reaching there, I realize that we have run out of time, and I know in our episode, the next episode, we are going to dig deeper and understand how adverse effects of this UTI can lead to an catastrophic type of health scare in our lives, both female and male. We shall concentrate on male and then we shall look at the female. Thank you very much. Thank you very much for following this channel. I understand that you have been educated, but this is just a start on the series that we have lined up for our discussions. Kindly subscribe to this channel so that next time when we meet, you don't have that hard time finding me or finding this channel so that we can all work together. Thank you. I really appreciate and be blessed. Thank you. Thank you so much. Thank you.